This teachable moment is brought to you by the Jewish Healthcare Foundation and the Pittsburgh Regional Health Initiative. When it was time to move the entire hospital to a new facility, the staff at Children's Hospital of Pittsburgh of UPMC did so without incident.
Hey Jen, do you want to move a hospital? The first thing that went through my mind was where do you begin? How do you even start to plan that? With a target date of moving of May 2nd, 2009, I was brought in to start planning the move process in January of 2007. You never want to scare a child that's in the hospital, and you never want to frighten the families. We felt that there was a need for a computer simulation because there were just way too many variables that we were dealing with. How many people does it take to move a child? I could change the number of patients that I had and how sick they were at any given time, and I could move them through this simulation, and at the end of it, I could see where patients were queued or where they were lined up and waiting for an elevator or for a resource.
We had it planned, we knew it, we had practiced it, we had rehearsed it, in large part because we had laid all that groundwork through the planning that you're forced to do when you do the simulation.
It was very, very important to us that we have a seamless move route, not only through the building, but also across town.
The principal measure of success was the movement of all children with no negative incidents.
And we started identifying ambulance services through a structured process that could facilitate and perform to our standards to move these patients from Oakland to Lawrenceville. We had 14 ambulance services providing over 40 ambulances.
We decided to do this all quickly in what we ended up calling rapid sequence transports.
When we moved in a red track and a blue track fashion. And each team consisted of either 2 nurses or a nurse, a respiratory therapist, a paramedic, an EMS, and their own vehicle, their own ambulance. If a child didn't have a parent to move with them that day, they were assigned a buddy who stayed with them from the beginning of the move day to the end of the move day. We barcoded every child so that we knew where they were in the move process the entire time. The move took 6.5 hours. We moved 152 patients. They moved 2.5 miles across town. We used over 250 people on move day. We were able to move every child without any problems at all.
And to have a day like that went so smoothly, in part because of the planning that I had a part in and that I led, is something that'll stick with me forever.
Children's Hospital in Pittsburgh is an outstanding facility, one of the best in the world. So it was really important to me to be part of it.
I personally felt honored to be a part of the move and to be a part of the coordination.
No one probably in their lifetime ever gets to move a children's hospital, especially not one that's this large and wonderful for the children.
When we finally did the move, in many ways it felt easier than much of the planning because it was so well scripted and there were so many people who really did their job in a superb way.